Although you may not have heard about it, jaw surgery is a commonly performed procedure around the world and has helped millions of people achieve proper jaw alignment, maximizing function, preventing abnormal tooth loss and chipping and damage and loss of teeth. The facial aesthetic changes can also help people with social issues and confidence issues and self-esteem issues in very significant ways, changing their life for the better. Jaw surgery is used to correct a malalignment or poor positioning of the jaws. When the bones of the face are in the wrong position, the teeth, by definition, are not able to contact and touch the other set of teeth in a normal fashion. The upper jaw can be too far forward and leave a person with a characteristic appearance, or too far back and the lower jaw can be too far forward or back. As well, the jaws may grow too much or not enough in a vertical position, as well leaving a person with the appearance of an extra gummy smile, no visible teeth when smiling, and a short face or a long face. Jaw surgery is treatment planned and performed by the orthodontist and the oral surgeon. These two professionals devise a plan based on the person's specific needs and desires and facial growth patterns, and then the orthodontist starts by moving the teeth into a position that is correct for after the jaw surgery. Since the bones are still in the wrong place, the patient often looks like the situation is getting worse before it gets better. This is because the teeth have compensated for the jaws being in the wrong position, and those compensations need to be fixed before the surgery. This can take 12 to 18 months before surgery. It is important to keep your mouth clean, see your dentist for regular cleanings, and follow all your orthodontist instructions. Once the teeth are in the correct position, the jaw surgery is completed. After the jaw surgery, 12 to 18 months of tooth movement and orthodontic care is required to finalize the position of the teeth and the bite. After this phase, the braces are removed and retainers are placed to prevent relapse or movement and changes in the bite. Proper planning with stone models, measurements, health information, photographs, and x-rays is paramount to achieve the desired results. These things will be done initially to devise a comprehensive diagnosis and plan to correct the situation. Prior to the surgical procedures, the oral surgeon will use plaster or virtual models to plan the surgery and make the corresponding guides, allowing the surgeon to do the surgery on models prior to the actual procedure. Software can be used to assist in the diagnosis and planning of potential jaw surgery. In order to move the tooth part of the jaws, once the patient is asleep with anesthesia, cuts are made in the bone in prescribed ways to make the tooth-bearing part of the jaw more separate from the hinge part of the jaw in the mandible or from the upper part of the face in upper jaw surgery. These incisions are almost always made from inside the mouth, and rarely do any incisions need to be made on the outside of the face. A common exception is the need to make a small nick on the lower cheek on the right and left side to allow for proper placement of plates and screws. Plates and screws are used to stabilize the bones after they are moved into the correct position. These plates and screws stay in place typically forever and only need to be removed if they are causing problems. These plates and screws make the need for wiring the jaws closed for an extended period of time, such as 6 weeks, a rare thing. Guiding elastics are used to help guide the jaws after the surgery. Each person is different, but healing follows some general patterns. Swelling typically peaks on the second day and slowly decreases over the next 6 to 12 weeks. Some patients will feel some fullness and swelling up to 9 months after surgery. Most people will take about 3 weeks off from their regular schedule, and no lifting over 30 pounds is allowed for 6 to 8 weeks after surgery. There are risks of jaw surgery, including things like infection. However, they usually respond to antibiotics, although in rare instances additional surgery, prolonged treatment, and hospital admission may be required to eliminate bad infections. Swelling, bleeding, and bruising are normal after this kind of surgery, and nosebleeds with upper jaw surgery also is normal and typically controlled with normal measures. Tooth roots may be damaged with this kind of surgery and with the placement of plates or screws, and may require root canals or extraction of teeth. You will be required to have a soft, non-chew diet after the surgery for 6 weeks. No chewing is permitted because the force of chewing can cause plates and screws to break, leading to additional surgery, and bones can heal in abnormal ways such as malunion, non-union, and fibrous union, especially when chewing is done in the first 6 weeks or more after surgery. Nerve damage can occur with upper and lower jaw surgery, leading to temporary or permanent numbness or tingling of the lips, cheeks, gums, teeth, tongue, and nose. This nerve damage can rarely cause painful nerve conditions that may require more treatment or surgery and may be permanent. Significant improvement or complete remission of the numbness may occur after the surgery over the first 6 to 9 months. Sinuses are directly involved with upper jaw surgery and may get infected or need antibiotics or additional surgery and the assistance of an ear, nose, and throat doctor to fully heal. If the jawbones heal in the wrong spot or poorly, additional surgery may be required to fix the bad bite, and the jaw joints may start clicking or making noises or have noises change in different ways and may become painful after jaw surgery. Please tell your oral surgeon and orthodontist about what your expectations and goals are for this surgery. It is very important to have realistic expectations to avoid disappointment. Please discuss any questions or concerns you or your family may have about corrective jaw surgery so that you have clear and realistic expectations and so that you feel comfortable signing an informed consent form. This gives the surgeon and the surgical team permission to do the planned procedures you are expecting. Your surgeon is fully committed to your understanding and care for these planned procedures. Thank you for your attention.